I'm Owen Barros, and this is Common Question in Veterinary Toxicology. The toxicology is a vast subject. The animals are exposed to numerous drugs, house products, plants, chemicals, pesticides, and venomous animals. This video serves to address some of the common questions asked when dealing with animals with possible poisoning. First question. What is the toxic dose of racing or grapes in dogs? Okay, the grapes, grape skin, and their dried products can cause renal failure in dogs. The fruits can be ingested raw or cooked in fruit cakes and other baked goods. The toxic mechanism that results in renal toxicity is known, but the lack of response thus might reflect a component of grapes or their product that is present in variable quantities, or an intrinsic compound that is not always present in the grapes. The hypotheses include tannin intolerance, contamination of fruit with mycotoxins, pesticides or heavy metals, or excess of vitamin D. I recommend don't give grape to our dogs. Question number 2. What is the appropriate antidote for paracetamol poisoning? Okay, the paracetamol or acetaminophen toxicity is one of the commonest intoxication in humans and animals because this is readily available. The liver metabolizes the paracetamol by glucuronidation, sulfonidation, and oxidation pathways. All the detoxification pathways produce non-toxic metabolites which are excreted in the urine or the bile. The oxidation pathway, however, also results in formation of a highly reactive metabolism called N-acetyl-P-benzoquinoamine. This conjugates with glutathione, which limits the toxic effects. But once glutathione stores are exhausted, this reactive binds to the macromolecule and proteins, causing tissue necrosis in the liver. The antidotal therapy of the manager of paracetamol toxicity is to replace glutathione stores and increase the productivity of the another two pathways and control the hematology cells.
Chocolate. Cocoa contains caffeine in a toxic compound called theobromine. Theobromine intoxication in the dog gives clinical signs such as polydipsia, vomiting, diarrhea, abdominal distension, also hyperactivity, polyuria, ataxia, rigidity, tremors, and seizures. It can be observed tachycardia, tachypnea, cyanosis, hypertension, hyperthermia, bradycardia, hypotension, and in some cases serious to death. The lilies are ornamental plants that dogs can consume in homes. It is an intoxication that causes gastrointestinal damage such as abdominal pain, bloody diarrhea, kidney damage, but this doesn't cause death.